Welcome back from the break. Before the break, we were talking a little bit about chronic or any type of chronic complaint that you may be having and how to decipher whether or not that complaint warrants a visit to the doctor. And with that, a sore throat is one of those things that was a chronic complaint in the office today. And like I said before the break, if you have a chronic sore throat, it's unlikely that it is infectious. Certainly if it's lasting one particular month or something along that line. So we're going to take a small brief intermission. Ray's on the phone. Ray.
Hey Doc, how's it going? 2 weeks in a row you're there.
Good. Hang on a second, Ray. I'm not able to hear you. Let me get my producer in here to bring those speakers up so that I can hear what you're asking. So hang on a second.
Okay.
We'll get that going here. Okay. Maybe I can hear you now.
Can you hear me now?
Yes, I can.
Hey, 2 weeks in a row. 2 weeks in a row you're on, Doc. It's wonderful, man.
Yeah, well, I've been trying to make sure I could get here for the show. It's been difficult, but it's been I'm not traveling much right now, so that's probably why it works. So,
you know what I suggest as far as possible heart attack or stroke or whatever. I always carry a fresh aspirin in my shirt pocket every day, and I find sometimes if I just feel a little bit funny, I'll just put the aspirin in my mouth, let it dissolve, and I feel better. Whether it works for everybody or not, but it's a simple precaution that may save somebody's life.
Mm-hmm.
That's what I believe in. There's one thing that I've been noticing with friends and relatives lately. Some of my friends are winding up in the emergency room in the middle of the night because they cannot urinate. And is there some kind of precaution to take where if you get up in the middle of the night so you don't have to go to the emergency room to get yourself going, like a hot bath or something? I know years ago I heard about something, but I forgot what it was. And it would be so important, instead of rushing to the emergency room and getting the catheter put in, if there's some way to naturally get it going.
Mm-hmm.
Appreciate it. And I know there must be some technique that people know about, and maybe you can enlighten us on that.
I will, and then if you stay tuned, I'm working on a few slides that hopefully will be back on the last segment regarding the hantavirus, which you brought up, and a little bit about Middle Eastern respiratory syndrome. So, but to answer your question, usually the story of dysuria, or basically inability to urinate, starts long before the patient wakes up in the middle of the night and cannot urinate. However, that being said, there may be some mild prodromals to that. One of the things I would be concerned about is if you were getting up into the night, frequently urinating prior to that, and then all of a sudden you take something, a medication, or you get a cough, or you get a cold, or you're doing something that interferes with the bladder neck, and that would be something that's on an anticholinergic line, like an antihistamine, a pain medication that you just recently got prescribed, and then all of a sudden it tightens up that bladder neck, and then you can't urinate. And during the day you may not think about it, you may have the urge to go, and it doesn't loosen up during the evening. So the key to prevention here is that if you're having those particular symptoms, talk to your doctor long before it gets into an emergency situation where you're waking up in the middle of the night. But like everybody, they hope that it gets better, they hope that it goes away, and it certainly may not. And in males, that's benign prostatic hypertrophy is probably the biggest thing. Our prostates enlarge as we get older, and there's two mechanisms involved with this particular symptom of not being able to urinate. One of those is the constriction of the muscle in the bladder, as well as the growth of the prostate in general. So that being said, again, knowing that you're having to waking up in the middle of the night, a couple of times every 2 to 3 hours, and that frequency starts to get smaller, that's a key. That's an alarm, and you should see a physician about getting on some medication and making sure that the prostate doesn't contain any cancer, making sure your PSA is within normal limits. An ultrasound of the prostate can sometimes be very, very useful, and even the possibility of a urologic referral. That being said, what happens in the middle of the night if you wake up in your extreme amount of pain because your bladder has now gone from the size size of a small light bulb to the size of, let's say, half of a basketball, and you're in extreme amount of pain. And unfortunately, the bladder is spasming and going into a contraction. It's very difficult, again, to release that once you're being done, and really a catheter is probably the only thing that's going to relieve the obstruction. You have to bypass that prostate. And the reason I say that is because there are other remedies that might work, and I'm not really sure which ones. If you happen to have medication that if you took an antihistamine or you took something like that, it might wear off in a period of time. Or if you took a pain medication, it might wear off in a small period of time. But as the bladder enlarges, and that backflow of pressure will eventually involve the kidneys. And if it puts pressure up into the kidneys, then it's like a drain system, and it's going to plug up your kidneys, and it's going to reduce the kidney function. So that constant backwards pressure on the kidney will reduce filtration and ultimately damage the kidneys. And that condition is called hydronephrosis, or water on the kidney. One other condition that can cause that would be a kidney stone that is unable to pass. The bladder or the kidney continues to make urine, and it continues to try and pump that urine out of into the bladder, but it can't, so the blood flow continues pressuring, and so you've got this one pressure going this way, and the urine can't drain, and therefore it puts pressure on the basement membrane of the filtration system, and ultimately disrupts or destroys that filtering system, and your kidney will cease to function. So it's very important, if you're experiencing these increasing frequency in urination and sometimes difficulty, that you do seek attention, get on some medication, make sure there's no other organic cause to prevent that midnight trip to the emergency room. And of course, one of the things, the reason why it probably occurs mostly at nighttime, is because we drink a lot of fluids during the day. We have this thing called dependent edema, which means we're upright, and most of the fluid can tend to drain down into our legs. We sit, maybe we're not so active during the day, and therefore when we lay down, or we drink fluid at night, or we lay down, and the next thing we know, we're reabsorbing all this fluid, so we get this maximum influx of fluids into our system at nighttime, and then we urinate, or we didn't empty our bladder. In the office, we can do a simple test called a post-void residual. And what that means is you come into the office, and you drink a lot of water, you have a full bladder, and then you go to the bathroom, and we see how much residual urine is in your bladder. It's a very useful test. Normally, the bladder might contain 250 to 400 cc's of fluid, which would be about the size of an Arrowhead bottle of water, maybe a little bit more. And then after you urinate, there should be probably less than 50 cc's, and close to 25, your bladder contracts and it expels the urine. If there's more urine in there, then you have an outflow obstruction, and that can be the cause for the symptoms that you're determining. Now, in women, it's a little bit different, because women, as their bladder, basically, when they're young, they have all their pelvic ligaments are all intact, and the bladder is in the normal position. Add a few children in there, and multiple years, the pelvic area tends to so-called shift and becomes looser, so the bladder may tip. There may be a fibroid. There may be other issues where the bladder doesn't stay in the right position, and therefore they can't empty their bladder completely. And now in women, it could be a very complex situation, in that not able to empty your bladder could cause urinary tract infections, because they can't empty it completely. And that's one of the main causes of urinary tract infections in the summer in women. And I know I'm digressing off that subject, but in the summertime, women, because of the short urethra that they have, there's a lot of perineal bacteria, and that combined with sweat in the perineal areas that's hotter, allow that bacteria to move into the vaginal area, and therefore they are more likely to get a urinary tract infection. They tend to get a little dehydrated in the summer months, and therefore will develop a bacterial infection. Well, that being said, incomplete emptying of the bladder can also aid to that by basically allowing urine to remain in the bladder, and it's that constant flushing action of urine being out of the bladder that will allow for the decrease in urinary tract infections. So for most people, I would say hydrate yourself early in the day and lay off in the evening so that your body can have a chance to reabsorb and excrete those fluids, and not trying to play catch up. And if you try to play catch up all day from being dehydrated as you are in the summer, then you're likely to set yourself up for that midnight urge to go and you're not able to go. So that being said, do your hydration in the morning when your body needs it, not trying to play catch up and then have to go to the emergency room. So I hope that kind of explains that whole situation of trying to prevent this situation is a little bit of preventative medicine. One of the fortunate things as a male, as we get older, we don't make as much testosterone, so that usually tends to shut down continued prostate growth, but we do still make testosterone, so therefore we still have the tendency to enlarge our prostate over time. And the risk of prostate cancer, again, is basically dependent on the amount of time your body's exposed to testosterone over time. So the longer you live as a male, the more likelihood you will become ridden with prostate cancer. And that's another good reason, if you're getting nocturia, is to go to the doctor to let him do a PSA or a prostate ultrasound or a digital rectal exam to make sure that you're not having prostate cancer. I like the ultrasound the best as opposed to the digital rectal exam, only because nobody likes to have a finger placed in that particular area of the body. And it's very useful for if you have a large nodule, that's nice. But if you really want to look at small foci of cancer and enlarged prostate, I think the transrectal ultrasound tends to be the most sensitive test for that particular disease. Anyway, we're going to go to break, and when we come back, hopefully we'll bring up some slides on some latest and greatest viral material. Thank you very much for tuning in.